So today in this video I want to show you very different techniques to address sciatica. Sciatica is a very loose term that's been, I think, overused by in the medical field to diagnose a lot of very different conditions. The overall definition and general definition is pain referred from your lower back that is running down into your leg, and very often the pain is only in the leg and not in the back at all. The most common pattern is starting from the lower back or the hip and then running down the outside of your thigh, outside and back of your thigh, sometimes stopping at your knee and sometimes going below the knee and all the way into your toes, so you have tingling and numbness. A more rare version of that, and that would be involving a different level in your lumbar spine, would be on the very front of your thigh, just down to your knees. So the other thing I want to mention, all these techniques that I'm showing you, there is a disclaimer that comes with it because it doesn't work for everybody, especially since sciatica is such a loose term. A lot of people are commonly misdiagnosed with it when the problem comes from different things. So make sure that you have your symptoms and your condition assessed by a physical therapist or spinal professional that knows what they're doing, as a correct diagnosis is very key in you getting better and receiving the proper care. So please keep that in mind. So the first thing you can do, which is fairly similar to my other video that I showed you on stretching the different nerve in your leg, is in sitting. What you're going to do is bringing your leg straight while bringing your toes back, and at the same time looking up. So, and then coming down. By doing this, you're putting your sciatic nerve on a stretch and helping it mobilize. The nerve actually doesn't stretch. It's the sheath around the nerve that gets tight, or the nerve that gets compressed against other soft tissues, and it could be causing your tingling, your pain, the shooting pain down your leg, numbness, and so on. So with this one, you just go back and forth, pull there. And I wouldn't hold this stretch more than 2 seconds at a time, just like this. So with this one, you can do 2 sets of 20 repetitions. A modified knee to chest stretch is going to help you with is a self-assessment of your straight leg raise test. Generally, people that have sciatica and some other back problem have limitation in a straight leg raise test, which is the inability to lift the leg further than 20 to 40 degrees like this due to pain down their leg and reproduction of their symptoms either in their back or in their leg. So after doing that knee to chest stretch, what you should be able to see is an immediate improvement in how far you can lift your leg like this. So that would be a good self-test to do to see if you're getting some help from that. Is starting in this position on the side of your symptoms, you're going to grab your leg and pull toward you like this with your whole back relaxed, and pull. Make sure you pull your knee up and out like this, so towards your shoulder of the same side, and you're going to hold that stretch for a good 30 seconds. So I'm not going to hold it for 30 seconds, but so after 30 seconds you would just bring it back. You would repeat this 3 repetitions and then retest, and what you should see normally is a good improvement in how far you can perform a straight leg raise, so being able to go a little bit further with less symptoms. Another way to address your sciatica is by performing a maneuver that's called a gapping maneuver. And what this does, it opens the foramen, which is the hole where the nerve root comes out between each vertebrae in your spine. And that's going to create a little bit less pressure on that nerve root and allow it to move much better, and hence you having much less pain down your leg. So to do this on the ground using a pillow like this or a roll that you're gonna roll just like this. You're gonna put this right on the opposite side of your symptoms, so underneath your waist. So we'll stay with the left side. For symptoms, you're gonna bend your knees like this and start in that position. You're gonna start easy and just kind of turning like this and going back and forth. What this does is, with the position you're in, with that pillow underneath your waist, it side bends your spine, and with you going into a little bit of rotation, it opens or gap the joints, and that's going to allow for some decrease in your symptoms. So just go back and forth there, don't push too hard, just go into the tolerated range, and then once you've done, I don't know, 20 or 30 of those, what you can do is hold the position at the end and then let that stretch, and you should feel a pretty good relief with that. And again, this will help if the problem is coming from a joint stiffness that does not open. If your sciatica is actually coming from a disc problem, the rotation is not really advised. So again, the importance of having your symptoms diagnosed correctly. I hope all these were very helpful in helping you treating your sciatica. My next recommendation would be to see a manual physical therapist, a physical therapist that can help evaluate your condition and find out the causes of your sciatica and what movement tends to irritate your condition.